So we have Cashout. It goes with short code as always. Please make sure that you're with us. And as always, you have to choose option 2. And option 2 gives you TV3. Then when you dial it or you click it, you're going to get a message popping up or a prompt, professionally as we call it. And then the option will be for you to increase the number of tickets you have. And you have to choose those tickets. So you have 10, 20, 25, 30, or you can do that in multiple times. And you become one of those lucky winners. And whilst, maybe, for example, you nitpick on your teeth this morning, as you're having breakfast, you just quickly use that as part of the means to just while away the time, dial *439# and become one of those lucky winners. And as always, please join us. Let's have some great and exciting time right here on TV3 New Day. It's our time for us to do the discussions. And I have a couple of people who already have sent us messages. But let's also acknowledge all those who are on our stream, because we're very grateful. Without you, we will not be very successful in what we do, because you remain loyal. And among the number of issues, we'll be talking about the Ghana Journalists Association giving the ultimatum, or perhaps raising concern about why the president and the government has not issued a state of emergency when it comes to galamsey or illegal mining, more importantly. And then they believe that the fight needs to be intensified. And so we'll be talking about that. But more so, you might have heard about the incident in Tamale, the teaching hospital. The Minister of Health, he's been undertaking a number of unannounced visits. And I think that's the way he has to go. He works, especially putting a lot of the managers on their toes of these various public institutions. And for the Minister of Health, that's a good thing. But he had a bust up with the officials of the Tamale Teaching Hospital when he visited there. And subsequently, so far has led to the sacking of the chief executive of the hospital. Well, we'll see how that goes. I remember there was an incident like that 4 years ago, so at the Rich Hospital, where somebody also, who has subsequently become an MP, also sacked. I don't know whether it's the same incident related, so to speak. But this is what has happened. What does it mean? And do you think the minister was right? And we will take a look at that, because the doctors over there are on strike. The GMA chapter of the Tamale Teaching Hospital, they are on strike. That means that essential services being provided by the medical doctors would not be offered patients, and they'll have to look elsewhere, especially in times of emergency. So please make sure you join us. A couple of you have joined us. I have Neo Degni Atukwefio Zealous Dwayne has joined us from the UK. Great guy. A friend of mine is in town with a wife, Angela. Dr. Carl Domino from the United States, Charlotte, North Carolina. Wish you all the best for the morning as well. And Victor has also joined Money and the rest of the team. But this is our introduction. So let me just quickly introduce to you Dr. Susan Idwamanka. Good morning to you. Good morning, Ryan. Well, she is a public health pharmacist by profession, and then also works with Noguchi as well, but comments on all things politics indeed. She loves it. That's why she's still in the space. But more importantly, let's roll back. What transpired at the teaching hospital, talk about it. And this is the bust up fest. The minister having that interaction. He was there alongside a member of parliament and also a deputy Rose Minister, Sohiyeni as well.
Told me that there's one here and there's a staff. The staff also have one here. And that's why you brought me here, to come and see. Yes. Is that not the point? Meanwhile, it's not accessible to the patients.
No, it's only accessible when the taps open. So that's the situation. So for a while now, water hasn't been flowing in there. And that's why I wanted you to see. You see that there are sachets. People enter there and they use sachet water and then just dump it there. And that's the situation.
At least, even if it is not being used, they can't clean the place and lock it.
There's no water.
No, you can clean the place and lock.
There's no water to scrub the place.
You don't have water to do anything. You can make arrangements for the tankers, yes. the tankers to bring water, and so you don't have that arrangement. Dr. Tik, you are telling me that you can't have water for this place to run this facility?
No, we get yes.
This is Dr. Valentine. He's the HOD of the emergency. And one night we didn't have water in the emergency, and he himself got them to get the yellow barrels to come and bring water for the nurses to work. So at our level, sometimes my HOD does his best.
Yes, Doc, I agree. And I'm the first person to admit that there are challenges with respect to water in Tamale. But that's why you're a leader here, that's why you're a CEO here. Not until we resolve the issue completely. I've been on the committee for a very long time. And we have always been talking about this. And we think, we know that you have a way of providing water for the facility until we solve the issue permanently. And that is what you have been briefing us. We know that the Tamale water challenge goes beyond the facility. It's well known in the country and all that. But you cannot tell me that, because if you are not very careful, people come here and pick the diseases from here and go home. That's what it is. And you know, you're a medical doctor.
Yes, sir.
So they will come here because there's no water. The person is sick. He comes here and picks the disease and he goes with the disease because there's no water.
So we have the 2 weeks. They went the whole day, they were allowed to 4 trips. That 4 trips alone cannot dialyze them or take care of the dialysis unit for a day. Because when you open one dialysis machine, like you open a tap. So the 4 tankers a day is not enough. So when the water can we prioritize. We have the public toilet that we have for patients. So if this one is locked, then they'll use the public one. It's outside one built by GMPC. So maybe on the way we will prepare the only is a bit far from here.
No, but I've come because of you, don't worry.
And a number of you, not only residents, but also agencies that work with NGOs in Tamale and the northern part of Ghana, particularly Sheikh Abubakar Ali Napari, founder, and then also the chief executive for the Salt and Light Foundation, has been giving me a number of messages. He says that there needs to be a total overhauling, whatever that means. And because this also should set as an example for other hospitals as well. And then also he's calling on all those who are on strike and even the man who has been sacked to come on board so that, well, it's a very touching issue, but also very divisive or mixed reactive issue. But what do you say to that, especially since you're a health professional in that regard?
Okay, so we are mixing the stories because they are 2 different issues. The head of TTH being sacked is different from the person who had the altercation with the minister.
That's true.
So, but people said that. Yeah, people are saying, oh, who does the minister think he is because he had this altercation? Because the man that had the altercation, or the health professional that had the altercation with the
I'm told he's the head of the emergency.
He's the head of the emergency. Is a different person altogether. So we have to separate them. I believe that like most heads in public institutions, we have they become political appointees. So the head of the teaching hospital, they are more or less political appointees. So it is the political appointee that I believe that has been sacked, and like they say, I mean, that one, even though we're trying to speak against these things, it comes as no surprise because the buck stops with you, and if you haven't delivered or they feel that you haven't worked hard enough, it is easy to replace you. If the story that I have been informed is to be true, a young man came in earlier in the week, and he came in quite a serious condition. The emergency could not deal, so they asked that the ICU take him in. I guess in between that period, the young man died, you know, and there was some maybe discussion going on between the ICU and the emergency, and some unhappiness. And I think the relatives of the young man may have heard it and were also quite unhappy. the minister goes to visit on Tuesday, and he's going round to visit. And we saw from his the clip that you showed, he was unhappy with quite a number of things. I mean, the washroom, for instance. And I also have a problem with that, especially in our public spaces. The least we can do is to keep our washrooms clean, you know, and ensure that at least when, you know, people go there, they can have some clean place to perform, you know, quite a private body function. You get it?
Yes.
And our washrooms are terrible. So I can imagine, because I think that I even saw the minister wear a mask to go there. So that he had those issues with them. Now he gets to this emergency, and I guess the complaints are going on. They don't have enough equipment, etc. And I believe that the head of the emergency, maybe out of frustration, I don't know, said, "But why are we even bothering with this?" And
that course, it's a daily issue.
Yes, that it happens all the time and things like that. But you have to realize that one life is a lot. One life can actually, you know, one life lost can destroy a whole generation. You get it? You know, children may not go to school, you know, drop out, and a cycle of poverty can happen with just one life being lost. So it's not just one life. You understand? It's a precious life. Everybody's life is precious, and it could be anybody's relative. You wouldn't be happy with such a remark. So I think that is what brought about the altercation, where, you know, both the minister and the MP were very unhappy with that remark, you know. And of course, life goes on. I'm hard pressed to understand why the doctors would put other people's lives on the line, you understand, to get an apology and say that the atmosphere is hostile and etc. etc. The minister doesn't work there, and I don't believe he has created a hostile environment. This minister, he's acting true to character. You understand?
Well, how do you mean?
Oh, look, when he was ranking...
Akando?
Yes. When he was
the ranking
member.
On the health committee.
On the health committee. Remember he went to Kolebu?
Yeah.
There was a lift
Johnny
issue.
Did the lift issue.
Yeah. So he likes to keep people on the toes. He likes to see things as is, instead of this announcement, I'm coming and all the things are covered up, etc. He likes to be on the ground to see things as they really and truly are. And I believe that that is what he went to do and has seen, you know, instead of having a polished view of the things. Because sometimes when you move up, you are not told the actual truth of certain things. You have a fair idea of what things are, but you know, but sometimes you need to see and feel and put yourself in the shoes of the patients that come in. So for me, I don't believe that he has created a hostile environment, nothing.
So let me get your point. So you're saying that the reaction by the medical doctors to undertake the strike, just as a result of the bust up and so want an apology, is wrongly placed?
Yeah, especially that. Because I have heard, yes, they don't have enough equipment. I think Tamale Teaching Hospital has suffered from a lack of equipment, maintenance, etc., for a number of years now. It's not necessarily a new thing. Maybe somebody corrects me. If they had been, the doctors there had consistently maybe writing letters, you know, drumming home the fact that we are under-equipped. I mean, this is an emergency. People come here in an emergency. We are under-equipped. We don't have this. We don't have that. And it had been constant, and there are letters to prove. It's not just a matter of just saying it. Evidence to prove that they had been trying to drum this home to the authorities and the powers that be. Then you can say that, okay, maybe they had, but on the, if they say that the apology is a deal breaker, and that if he doesn't apologize, they are not going to come and what do you call it, to work, and so lives should be lost. I really take
purely misplaced.
For me, it really is. I mean, who are they punishing? The poor people of Tamale and its environments, or they think that they are punishing the minister? They in that roundabout fashion, when lives are lost, and what happens? The minister loses his job. He will get another job.
Yeah.
It is not a life that is lost. You understand? And they have to realize that, you know, they should not be using other human beings as hostages to something. You understand? Look, I was reading a story about in South Korea where they were protesting about something, and yet they went to work. They had the equivalent of armbands, red armbands, to show that they were protesting. You understand? And they said that as long as their demands have not been met, they will continue to protest. But they didn't put people's lives on the line. You understand? Because they understood the bigger picture than just putting people's lives on the line. I would hope that, yes, they can protest about a lack of equipment, etc., etc., etc. But the apology should not be the deal breaker, nor should I mean, even the lack of equipment be an avenue for them to say we are downing our tools, or we are downing whatever tools we have
in reaction to. All right, so something has got to give, and you're saying that this is not the way to go.
No, I don't think so.
I think more importantly, if we put all the matters into perspective, and I will welcome as well. Good morning to you. How are you?
Good morning. I'm fine.
Great.
Sorry for being late.
I know that we called you the last minute, so that's the point of it. But we need to situate the conversation very well. And this morning, Cookie and I, we raised this issue as a point of discussion during the this morning conversation. Okay. And the position I held, for example, was that generally, if you go to public hospitals, you will find that for the main referral hospitals, whether it's Kolebu and the others, that they call general, however they want to refer them, you will find that their administrative setup could do better. That is my view. Okay. And that the observation is that you will find that there are services that are provided by private entities just meters close by these hospitals. And they even recommend that because they don't have the facilities, or the facilities have broken down, whether it's an MRI machine, etc., then they recommend, go to this outfit that is just down the road. Go and do this lab or this scan or this x-ray and bring it. So my question to you is, what is your observation generally in relation to what has happened in Tamale about how public hospitals seem to be managed?
Thank you so much, Roland, and greetings to our viewers. Auntie, is that your hair? I love it.
You love it, eh?
Seriously. This public hospital or public institutions with all those tags, I think it's high time we do something about it. When the thing is public, because I remember growing up, when you try to do something out of the ordinary, ejumano papadia. Is it for your father? Is it for you? Why are you just killing yourself over something that is not yours or personal? And sometimes I sit down and I ask myself, we Ghanaians, what's wrong with us? You see Ghanaians outside and it's like we want to even use our heads to work, not our hands. And when we are in this country, it's like nobody cares what happens to us as a people and all that. Me, I have had a course of fighting with nurses, especially when I'm pregnant. You know, when we are pregnant, we're on a different ball game. And you go and you see a nurse who also wants to throw their weights about and all that. I remember one time I had to tell a nurse, if all of us were nurses, nobody will be in the market to sell for you. Nobody will farm for you to go buy food. And when it comes to our public institutions, especially when it comes to the health sector, it's so appalling. And what I've also observed is most of this, like you were saying, they will ask you to go here. Most of these things belong to the health practitioners. In most of those, especially Kolebu, you go to a scan center, it belongs to a doctor. You go to a CC, whatever, those big places, and you see it belongs to most of them. And sometimes they will have to work there before they come to the public hospitals to come and work. And this thing have affected us. And when you look at our ratio, patients ratio to our medical personnel, we don't even have it. But we have cases whereby even when people want enrollment in the medical school, they want to know if you're, if there's anybody in your background who is a medical doctor before you are even given a slot, no matter how. Who told you that? Oh, me, I have. I have a lot of medical personnel in my house.
Okay.
So I know how these things work, and especially, I won't mention.
Okay.
Because when they see that when your father was here or your uncle was here, your grandfather was here, he did this, so we'll make sure we pay you back. One of our cousins has to drop out of the medicine to do those kind of things. I've forgotten the name they have it. Just because a medical doctor, because of what the grandpa did, will not allow you even have peace to want to study and come out as a medical personnel. And if you want to go back to what happened in the north, Tamale, when I saw the clip, I was like, and if you followed our minister, he's someone who wants things done properly. He's someone who always wants results. And it's like we always want to complain. And when I heard the leader, what was the name, saying that I've been doing it, there's no water here. So how can a whole hospital tell a minister that we don't get water and you call yourself a leader? But that is true. Generally, Tamale Metropolis has a water issue. And this is a hospital. Because of that, you will find a way of getting water. Okay. Can't you get boreholes? Can't you get tankers getting you water? No, there should always be an avenue to get whatever you need. We were in this country when they said there was operation being done and lights went off. There was no generator. We tried to bring a generator. During Tarzan's time, the generator never got to Accra or never got to Ghana. However, it went. We lost touch of that thing, and it's like we are living our normal lives. Nobody even is asking any questions. But these things are happening every day. You go there, we don't have instruments. Yes. Look, one thing that can be so frustrating is when you are willing to work and you don't have what it takes to work with. And so you're saying that you empathize with the doctors and the nurses? Yes. On one hand? Yes. But at the end of the day, you're saying they could do better? Sure. Okay. How Did they ask question? Or have they been asking for? NDC has been in power just for 4 months. Or let's say 3 months, not even 4 months, one want to put it that way. But have they been asking? What happened previously? They were just there, nobody cared, or what? As a medical professionals, I'm sure they have a code of ethics and whatever. I know they have this Nightingale, whatever Nightingale is the nurses, the doctors. These are nurses. Oh, they are all medical. Hippocratic. Okay, thank you. You are in the pharmacy district. So if all of them were, these things were going on, did they ask questions? Were they asking for things and it never came? So why is it that now that action is being taken? Because I feel that you did not do something right. Now you are coming back to tell me that because of ABCD, I'm not going to work. What happened then? Is it that you didn't have voices to speak? Or nobody cared about what was happening? Now everybody is just unconcerned. You feel that this is not my family. So if the person dies, I don't care. But you see, there was an issue in one of the institutions. His own colleague, I think, gave them a wrong diagnosis for an operation. And it went bad because when they cut the person open, they realized that wasn't the issue. And he was taking his own colleague to court. And so one of the doctors asked him, is this the first time something like this have happened in this hospital? But because it's a relative of yours, you're having issues with it. But things like that have happened over the years. We are fallible, we are human beings. But it doesn't also mean that because the person is not related to you or not close to you, you don't care what happened to the person. As soon as it is yours, you want to cry over it. What are they looking for apologies for? That's what? I don't know. So the question is, could Mr. Kando have handled the situation better? Even though he usually is in that
type of element, so to speak? That's the question.
So he should come and apologize for what? For telling him he did wrong? What's wrong with us in this nation? Because it's like everybody is now on their high horses because it's a different government. We feel that NDC will not speak or we are too early. All these years, 8 years, did you call for all those things you are calling for now? We are not saying we shouldn't because we knew that things were bad. That's why we said we were a better alternative. But if the minister had not gotten there, the minister and the MP, would they have known that there was an issue even there? No. You've not even gone to your minister to tell them this is the issue we are having before you came to power. So can you find a way of helping this institution? Because people are dying. Things are not going right in this hospital. Did he show any care? Or did any of them? And they're looking for apology. For what?
All right. Did the minister react too quickly? Or perhaps had overreached his power, so to speak, in terms of his temperament?
Overreached his powers, which one? You mean the sacking of
yes, because...
But that has nothing to do with the altercation.
No,
do you understand? Because the altercation was between the head of emergency and the minister, which was precipitated by the remark made by the head of emergency about why we even bothering. You understand? So that's a totally different thing from the dismissal of the head of the TTH. You understand? That he is a political appointee. The buck stops with him in terms of management of the hospital, etc.
So ultimate culpable responsibility.
So he has the ultimate responsibility. So that's a totally different issue. If he feels as if he's been wrongly dismissed, you understand? There are avenues for wrongful dismissal, and he can take them on and say, look, I was dismissed wrongly, etc., 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 etc. And, you know, we've seen it in many places where if they've been dismissed wrongly, it has been dealt with, and, you know, people have received compensation if it's found to be true. You understand? So those are different issues. On the issue about what happened in terms of the apology they're asking for, the Doctors Association in Tamale are not asking for an apology for the
dismissal of the CEO.
No, that's not what they're asking for. They're asking for an apology
for the bus stop.
But the issue is, the bus stop, it didn't happen spontaneously. You understand? Or it didn't happen because the minister went there. Something happened, and that happened. So there are two sides to that issue. You get it? I think that, yes, that remark was unfortunate. Maybe the minister didn't take kindly to it. I'm sure a lot of people would not have taken kindly to it. Sometimes when those of us who work in the medical profession, there is a time that comes where we become a little numb to certain hardships, because we see those hardships all the time. You know, you probably see, and so we build a certain mental barrier, you know, so that it doesn't affect your call. You really don't want to go home and still be thinking about it, and it can affect you. I'm sure if we were to do a random evaluation of the mental health of healthcare professionals, we would find that a lot of us are in serious trouble with mental health. But so we build a certain numbness to it that appears as a cold, aloof, and nonchalant attitude, and sometimes that nonchalance trips and becomes like that. So if you have a person who is maybe a caring person, who is empathetic to certain situations, and you make such a remark, it won't bring out an altercation. You get it? I believe that they have to insist on having the proper work tools, the proper environment, etc., to work with. What I don't agree with is putting other people's lives on the line to get that. Look, none of our hospitals here, and somebody should correct me if I'm wrong, none of the Ghana Health Service hospitals are adhering to any standards, for instance. Well, of course,
comparable to...
comparable to... So, they are healthcare standards. We have ISO 710, which is for health facility management. How many of them have even attempted to do that, to put in a quality management system to ensure that it works? I was in Sri Lanka last year. Sri Lanka is a third world country, just as we are. In the government hospital, they had put in, they were practicing a Kaizen. And in the Kaizen is a quality management philosophy, which talks about continuous improvement. And it has in it a tool called the 5S, where you set, you sort. In fact, Rich Hospital, if you go to their maternity facility, they are practicing it, and you can see the difference. And this is a government institution. They don't have much money, they don't get much money in a low-resource country, and yet you wouldn't believe how neat that place is, how things function.
The hospital you went?
Yes, the hospital I went. And it's a government hospital. We only visited government hospitals, you understand, who are practicing the 5S, which is being practiced in the maternity unit of the Rich Hospital. Go there and go there and you'll be amazed what they are doing with the little that they have. We should be able to do and replicate that in our hospitals, irrespective of what we have, because the Kaizen principle and of course the 5S tool does not require you to have much. There are so many things that can be done with a little money, you understand? And with that little money, you can prioritize, you know, looking at the data. What machines require maintenance at what time? Where can we find the money? Because it makes you look ahead of time. We are having poorly run hospitals. I don't know in what principles that we are running those hospitals, or with what international standards they are running them. But this is why we have the issues that we have.
But who is supposed to provide the facility? It's government.
Government is supposed to provide the facility. Yes, government is supposed to do that. And government can do only so much, because we all know what happens to the hands that are pulling at government to get resources. Unfortunately, the health sector may get shortchanged, but with what they have, you understand, how have they really proven that even with the little we have, you know, we are managing it in such a way that it can give us the best results? Yes, there are some fantastic doctors out there. Look, I mean, if you go to Kolebu, you will have one of a cadre of doctors there who are fantastic. You have fantastic doctors across who would put their own monies even to ensure that patients. But we are looking at the holistic picture. What kind of quality management standards have we put in place in our hospitals, so that even for low resource country like us, the little that we have that we can do without money, washrooms, please, we don't need loads of money to ensure that our washrooms are kept clean. You understand? So I think that...
And then the maintenance of the machines.
The maintenance of the machine. It is not just government. We as employees must also be engaged. We as employees must be involved in ensuring that our workplace and whatever tools that we have, they can go further than what it's meant for.
Fantastic. I mean, I'm just getting, you just do a cursory review of literature, and it says that Ghana's doctor-to-patient ratio is 1 to 10,450 Ghanaians. 1 to 10,450 Ghanaians. The WHO recommended rate or ratio or level is 1 to 1,320. That is if you don't have at all. All right. So just so you know, that's why our health workers run away, because we put them too much stress. On the other hand, we also want them to make use and do well with the little they have, right? Well, Christopher has been giving us the latest. Christopher Mako was on Ghana Tonight and will give us the latest update. And Christopher, from your update last night and then this morning, what can you tell us? Has been again, assigned reasons why the doctors are on strike. Now, really, how will this strike and the position they hold improve the situation, so to speak?
Yes, so Roland, this morning I am currently at the Tamale Teaching Hospital, the biggest referral center in the entire Northern Enclave. I have visited the emergency unit where the whole brouhaha happened and leading to the suspension of some of the critical services at that particular unit. Now, the good news is that since yesterday night, when the release from the doctors came out that they were suspending some of their services, there hasn't been any emergency case coming in from anywhere, and so that is the good news. The doctors in their release indicated that they are going to take care of inpatients, but the new cases that will come, they will not attend to them. And so, having visited the emergency unit, the nurses are at post, going about their normal duties. The doctors are yet to come, because I was told that they will be coming from 8 o'clock going, and so maybe some of them have already arrived at the emergency unit to take care of the inpatients. But Roland, let me also say that the few patient relatives I have engaged since coming here have been telling me that the situation they find themselves in is not helping, because you have heard that the doctors have suspended their services, some of their services, in the heat of the challenges that the hospital is faced with. Is something that they think that it is going to have an impact on healthcare delivery, especially for people who will be coming to the hospital from this morning. Roland, let me also say that the nurses are not equally too happy about what happened at the emergency unit between the head of the accident and emergency unit and the health minister, as well as the member of parliament for Tamale North constituency. They say that they have been sacrificing to deal with some of the challenges of the hospital. And so for the minister to come and vent his anger over an explanation that the head of the unit was giving wasn't the best. And so the call for an apology from the doctors at PCH is in order. The fact that they are also requesting for some improvement in the incentives and tools that they use to work is also a call in the right direction. Some of the patients' relatives, Roland, have actually been telling me as well that they go outside to buy lines for them to do transfusion. They go outside to buy glass. They go outside to buy gauze and other basic consumables that the hospital will need to provide its services. Roland, let me also put this on record that dialysis patients who come to the hospital as it stands now, most of them are turned away, because as we speak, only one dialysis machine is functioning and taking care of over 1,000 of the patients who come seeking these services. So when they come and they don't get the services, they are frustrated. Those who can afford much more will have to go for private services. And so, Roland, it's a very dark situation as we speak. And I must say that the patients here and their relatives are bearing the brunt of the challenges, enormous challenges the hospital is faced with.
Now, at what point in time are they going to have that conversation with the minister or the ministry? Or have you had any information that the ministry or the minister is willing to have that conversation with them? Because in their warning release, I call it a warning release, they say they want the minister to apologize.
Yes, I have been engaging some of the doctors because they said they are not going to speak on camera. But what they've been telling me is that they are not too happy with what happened. They are only waiting for the minister to render his unqualified apology. In fact, that is the major thing of their released. Earlier yesterday, you know that they came out or issued a statement in the morning, and in that statement, one thing was certain. All they wanted was an apology from the minister. They emphasized that apology aspect in their second release yesterday in the evening, what you call the warning release. And so what they are saying is that whichever way he will want to do it, whether in writing, whether he will go to one of the national media houses or come back to Tamale where this incident happened to render an unqualified apology to the said doctor, they are ready to accept it. And it shouldn't just be an apology, it should be something that will come from the minister's heart, where he will show remorse to his actions that he took at the emergency unit. Roland, let me, for the purposes of our viewers, take us through what really the cause of this brouhaha was. Now, when the minister visited, he was taking around some of the units and departments of the hospital to have a fair idea of how the operations of the hospital has been over the period. And let me also state that his main reason for coming has to do with a death case that was reported at the emergency unit, where a patient was referred from a private health facility to the Tamale Teaching Hospital over the weekend. And when the patient came, according to the doctors, he came in a very dire situation where he needed some critical service at the intensive care unit. And so they were able to manage the patient because the patient's condition had deteriorated because of the delay in transferring or referring the person from that private health facility to the Tamale Teaching Hospital. And so, unfortunately, because of the situation, because of the deteriorating situation of the patient, they needed a ventilator to be able to move the person to the ICU. Unfortunately, the emergency unit didn't have that, and the hospital has 4 ventilators. 1 is broken down, and 3 are currently working at the ICU. Unfortunately, after the time they needed the ventilator, patients were on it, and so they could not do anything about it. The patient lost his life. Very unfortunate. Now, when the minister got to the emergency unit, he inquired about the situation. So the said doctor in the center of the controversy, Dr. Valentine, was explaining to the minister what caused the death. But after his explanation and also adding the challenges of the hospital, he made a comment that even though this is not news, because they have recorded similar deaths over the period, and they didn't hear anything about it because it's not their fault. It is as a result of the lack of the basic tools that they are supposed to work with, even though they do their sacrificial job. And so he used a comment, a phrase that he doesn't understand why this particular one is being blown out of proportion. And that was where the Honorable MP for Tamale North, Alasan Suyini, took offense to that comment, that he shouldn't have said that because a life was lost and every life matters. And so there was some misunderstanding there, because the doctor wanted to really say, yes, a life was lost, but it is no fault of ours because we tried to manage the person. If the person had been moved to the ICU with the necessary tools that they needed, the person may not have lost his life. And so they tried calming him down. Then he said that once the minister is here, it is good for us to lay the challenges directly to him so that he doesn't go and feel like everything is all right at the facility. So the minister took offense to that he was being disrespectful to him with his attitude and comments. And so that was where the altercation began. And now the medical doctor actually was trying to put the minister that, let's be sincere, let's face the fact, these are the challenges. So if you want us to also work as we are supposed to do, if you are querying us for the life lost, also as a ministry, make sure that you give us the necessary incentives to be able to deliver. And so the exchanges began, and that was it. So that was actually what transpired and what led to the incident that we all saw. The doctor was explaining the challenges, but he used a phrase that the MP for Tamale North and the minister didn't like. And here comment was that if as a minister, the medical doctor was talking to him with that attitude, he wonders how he will relate to patients or patients' relatives. And so that was what happened, Roland.
Do you think that the whole situation has been misconstrued in terms of it's been blown out of proportion, so to speak? Just a minute on this. 60 seconds.
Well, Roland, let me say that it was a misunderstanding, and the misunderstanding, as it happened, was supposed to give information to a certain challenge, but one party did not actually understand because of the attitude that they felt the doctor was portraying. And so it was blown out of proportion because right now as we speak, had it not been for this, that Media General TV3 is doing, we won't even get to know the challenges of the hospital, because it looked as if the confusion, the misunderstanding took the shine of the real challenges that the hospital is faced with. And so I think that not really that it was blown out of proportion as in the confusion, but it was also good that we get to know that service providers are ready to lay their challenges to the relevant authorities, even though it should have gone through management. But once the minister was there, I feel that the doctor had the opportunity to also tell the minister the challenges of the hospital.
Well, so what do you read into all this, so to speak?
I don't know. After even this, if these doctors will still insist
for an apology,
I will be shocked. Not their colleague apology.
Well, they are insisting. It's in a statement. That's their position. That's why they're on strike.
They can go on strike because, like Auntie said, they become so numb to some of these things. Because
Who's
I remember,
your auntie?
I call her Auntie.
Ah, okay.
You see, I remember one time they were going on strike. When we speak, they told us that people die every day anyway. So it's like they don't even care when people die. Because if you are telling us, why are we blowing this thing out of proportion? It's happened before, or it happens most of the time. Then you don't even care what happens to human life in that hospital. That's what you are trying to tell us. And if the minister got angry because of what you said, because they are being filmed, or if anything, you are on this thing, saying this, and you expect the minister to be happy. So that people will also sit somewhere and say that, oh, after all, the minister was happy, these things were happening. And you know the kind of politics we do in this country. And they themselves will even go and sit down and turn this whole thing against the minister. And it's unfortunate doctors of their caliber will sit and they say they want an apology. Me, if I were the minister sitting here, I will never and ever apologize to them.
Never.
They don't deserve it. Because of the kind of things that went on and the demeanor and the kind of posture they were even showing the minister and the MP. They want to tell us you can go to hell. This is not the first person who is dying here. Things are happening. So if somebody dies, what's the big deal? And you want the minister to come and apologize because of this posture you people took upon yourself and the minister. I won't get it. If I'm a minister, I would have done even maybe worse. Because I want the right things done. Okay. You don't have instruments. You don't have machines and all that. Have you been able to go to the minister since he took office? No, you've not done that. The person has heard something, things are happening. He decided to come to your place unannounced. And we realize that things are bad. And instead of you even coming that we are sorry, they should be apologizing to the families. Because we know that, if anything, nobody is saying that you went there to go and kill somebody. But there was a problem. Okay. And families are not happy with it. You will do something and families will... there are certain families, oh, okay, it has happened already. But there are others who want to go into it and make sure that they know what happened. At least so that it doesn't happen to the next person. And if you are giving us this posture, you want who to come and apologize.
What we're trying to do is to get somebody also from...
apologize.
Okay.
What we're trying to do is also to get somebody who is a medical practitioner, not on the side of being a doctor, but a nurse, to give us a perspective from the UK as well. So we'll do that very soon. But so what should be the position of the minister?
I mean, the minister should apologize. He's stronger, he's bigger, he's more empathetic. If that is what it will get to save lives, let him apologize. Look, we are in Easter. What did Christ say? Somebody slaps you, you turn the other cheek. It is always the stronger and the bigger and the more moral person who, even in the face of everybody knowing who is right, will say, I'm sorry, can we move on? Because lives are lost. It doesn't take anything away from him. He doesn't. Look, I mean, we know where the contempt will be. And the contempt will not be on the minister if he goes to apologize and says, you know what, we had an altercation, it doesn't matter, I apologize, go back to work because I want lives to be saved. We know where we will pour our contempt. You understand? Look, we should not let be pride. If the doctors, because of pride and wanting to save face, want to put other people's lives on the line and allow life to be lost, the minister should not allow it.
Okay. So you're almost saying that the minister shouldn't apologize?
He's the bigger man. He should apologize. I'm not saying that's what...
Okay. So you're saying that he should apologize not for being wrong?
No, he should not apologize for not being wrong. That's not why.
Okay.
They want him to apologize. It's okay. It's fine. As for that nonsense about whether it's from his heart or whatever, nobody knows his heart. Only God knows his heart. But if his apology will save lives, he should be the bigger man to say...
But he also has a responsibility to make sure that...
But as for the responsibility, he has a responsibility to ensure that they get the right things. It's not a magic one. It's not going to happen overnight. So nobody should expect that all of a sudden, then, yeah. But also we need to recognize that even if they got everything overnight and they don't have in place a proper management system, the things will break down again and we'll go back to zero. So we must put in place a proper quality management system. You understand? Hospitals have healthcare organization management. They have standards to it. You understand? That has equipment, how you maintain your equipment, how you maintain your personnel, how you speak to patients, etc. It's a whole broad system. You understand? Standard. Hospitals should go and take some of these standards and adhere to these standards so that even if a little money is poured into them, they can maintain the hospitals. Right now, if you poured all the money into TTH and they don't have a management system in place, it will collapse again. Okay. So I think that, for me, we should not let pride allow lives to be lost. If what it takes for lives to be saved is an apology, I don't think the minister is going to lose any respect. In fact, he gains more respect.
Okay. So you are not speaking for apology from the minister because you think he will be saying he's wrong?
No,
just because he wants the work to go.
It's not wrong. An altercation happened.
We'll try and speak to the Ghana Medical Association. Dr. Salome will be joining us on phone and we'll get the...
Brother, don't use my words.
Okay. No, please, you are here. I don't want problem.
Yes.
Yes. All right. And then also, we will be joined by a medical practitioner from the UK. He's a nursing practitioner. So we just want to look at the differences. For many of the times, we're being joined by Umar Farouk Mohammed. Please, if you can switch your frame to landscape, it will help. Okay, so you rotate the camera for us and then we'll get you in a better perspective. In the meantime, we'll get to Dr. Salome of the Ghana Medical Association. He's reached out that he wants to make a point on this. So Shadrach, please get back to the GMA, Dr. Salome, and then we'll get the latest update from them, their position on that. We'll do that on phone. But Umar, you are a nursing practitioner. Now tell me, what's the difference? I have personally heard my people I know who were practicing here, and they tell you the differences between the two sides. What do you think that at our hospitals we seem to be doing wrong, so to speak?
Thank you very much, Roland. Good morning to your listeners, and it's always a wonderful feeling talking to people back there. So, I mean, first of all, I don't want to say there is much of a disparity between the two systems. the issue at hand has to do with people not doing what needs to be done. So the difference has to do with in one of the systems, people are proactive doing what is right, and in the other system, people are a bit hesitant. People are not ready to do what is necessary, and people find excuses for not doing what needs to be done. I mean, talking on the issue of the TTH incident, watching the video, I happened to watch it at a very odd time, late in the night, and I felt like the earth should open for me to just disappear. It was so embarrassing and so.
Okay. Umar, I want you to do something for me. Just take your camera back a bit, create some stability for me so that I can get your headroom very good. Okay. If somebody else can hold it for you, that will even be better. So that I can get your headroom on it. I want your full frame in there so that we get, because I know you personally, you always complain about the rate at which we tend to practice. So that's why, okay, so now you can talk.
Yes, so as I said, Roland, the difference between the two systems is just the simple fact that in one of the systems, people are proactive. Laws are forcing people to do what is right. And in the other system, people are not proactive. People give excuses, and they bundle all these excuses into one and just say there are no resources. For instance, the issue of the Tamale Teaching Hospital incident. Look, it was very, very embarrassing watching it. And I heard one of the the guys in the studio saying the health minister should apologize. Then I'm sitting here wondering, what should the health minister apologize for, really? Look, Roland, look at the demeanor of the doctor who spoke. I mean, the doctor simply said to everybody, to Ghanaians and everybody, look, we've decided not to do what is meant to be done simply because there is no resources. And that has been the excuses for every single incompetence that people have had to exhibit in Ghana.
Okay.
And I'm saying this because I have had the privilege of working in A&E in Ghana, and I've worked in A&E here.
So tell me the differences. Usually, what's the approach in the management style and then care, so to speak?
Well, the case of the Tamale TTH case. Talking about ventilators. We are talking about someone who they had difficulty managing his airways. So they needed some form of an equipment to manage the person's airway. It is not just enough for the doctor to say, because we didn't get the equipment, we had to watch on for the person to die. So the minister had every single right to ask the questions he asked. As to whether it was available or not, there are alternative ways to deal with medical issues. Ventilator wasn't the alpha and omega of everything that happened there. There are other means, if I should put it that way. I genuinely wouldn't want to go into the specifics because time wouldn't allow us. But the difference is that people are proactive here. And having said this, let me quickly also say that, Roland, to hear the doctor say they had only 4 ICU beds in a teaching hospital was very, very embarrassing for me personally.
So it means that in your facility, for example, you have more than 4?
Well, Roland, in my hospital where I work in the UK, we have about 4 different areas. We have 2 broad areas in the ICU, we have area A and area B of the ICU. In each of these areas, we have about 4 different areas. And in these 4 different areas, we have about 8 specific areas. So we have neuro ICU, we have trauma, we have all sort of ICUs. We even have a general ICU. So in all, if we could be counting about 60 ICU bed, each of them well equipped to save lives. And that is what a teaching hospital should be looking at, 4 ICU bed. And Roland, this is something I've been saying over and over and over again. I said the health system in Ghana needs to be properly stratified. It needs to be properly stratified. The days where every case goes to the teaching hospital and every case goes to the district hospital and every case goes to the health center is far behind us.
Okay.
We need to understand that headache.
Umar, thank you for that update there, and we'll get the latest from you as well. And Umar practice in the UK giving us the latest on this. But at the end of the day, Dr. Susanna Mankwa, what do you think should be done now in relation to trying to breach what has become an issue nationwide, where we have management people who are health practitioners as well, and they go through issues, problems, lack of facilities. At the end of the day, we also expect a lot of responsibility, hands-on approach to be able to manage their facilities when it comes to health and patient care.
I think that we have signed on to have international health care standards. Okay. And we want to give everybody the best available health care that they can get anywhere in the world. Given that we are a resource poor country, or either that or we don't prioritize our health in the way that we should prioritize it, we need to sit and look at it. We need to probably even take models, okay, and look at what kind of model can we have that our people will get the best health care. Look at Cuba. Cuba is not that rich. And yet, you understand, but Cuba has one of the best health care systems in the world, even before any other first world country. You understand? What are they doing right? You get it. How are they managing such that their people? We should be able to look at this, and then we should take a standard for ourselves and try to adhere to that standard. I'm an ISO person, so I know about the healthcare management of healthcare organization management standards. We should take that because it deals with all, whether it's equipment, whether it's this, and what to do and what to do. If we're able to present this to government and say, look, these are our issues. In the situation that we find ourselves, if an ICU of a big teaching hospital like this, we only have 4 beds, it's a problem. This is the maximum we can work with. This is the minimum we can work with. Otherwise, this is the number of people and the lives you would lose.
Yeah.
You get it. We have to have clear plans and approach them. And then we also have to realize that healthcare and health is not just about hospitals. How do we prevent people from even getting to the hospitals in the first place? And take a broad approach to health. You understand? What is the kind of health promotion activities we can do, the kind of preventive actions we can do, that also minimize the number of people that are coming into our facilities. Because if you take water and sanitation, you understand, it's terrible out there. And so our people are going to the hospitals for all sorts of diarrheal diseases, which just some good hygiene and water will probably have prevented them from getting to that level. So we need to look at the healthcare holistically, not just as hospitals. I mean, you want to do the political bits in terms of Agenda 111, whatever. But how are you equipping the people? What primary healthcare program are you putting into place that the people take control of their health themselves? You understand? Food is too expensive in this country. Food. And, yesterday I wanted a watermelon. It starts from 50 cedis. Yeah. It goes as high as 150 watermelon.
You mean
one single watermelon selling for 150 cedis. If you are a civil servant and you are paid 3,000 cedis a month, how can you go and afford one watermelon for 100 cedis or even 50 cedis? You understand? But we need fruits in our lives. Have you asked for a banana lately? Do you understand? Food is expensive. The government needs to look at our health holistically. What kind of referral system do we have in terms of private hospitals and the teaching hospitals? You understand? Why would you keep somebody for so long just to collect their money before you send them to the hospital, the big hospitals? You understand? We need to look at it all around. But that is the longer term. In the shorter term, there are certain things we can achieve, and we should sit and plan and look at it. Okay. Coming to this case, and I want to say it again, it should not be about pride. No life should be lost because of pride. The doctors want to be prideful and everything. Look, if they said he told the minister the inefficiencies in the hospital or the inadequacies in the hospital and the lack of equipment, maybe the tone in which he said it annoyed the minister even more. Okay, that's fine. Okay, whatever. You understand. But we all know that when he made that statement, I don't know why you are blowing this out of proportion. That was a trigger for anybody who is empathetic, etc. It has happened. We don't want more lives to be lost. I will say the minister being the bigger person with a bigger heart and not wanting any life to be lost because of pride. You understand? Some people want to be, they feel that as if was when you made to for me, the minister should take the higher ground. Okay. I just saw something from Mother Teresa. She says it is the first to apologize is usually the bravest.
The saints.
The saint. Okay. Is Saint Mother Teresa. The first to apologize is the bravest and the strongest.
So the minister should be the first to apologize.
Usually the happiest. Look, he doesn't want lives to be lost. It will take nothing away from him. He is the bigger man. He is the better man. He should just go and say, okay, I apologize. Please go back to work and save lives.
Okay, we have the General Secretary of the Ghana Medical Association, Dr. Salome, on the line. And good morning to you, Dr. Salome.
Good morning to you, Roland, and good morning to your panelists.
So, you the doctors, you decided to align with your colleagues at the National Headquarters and then Tamale Teaching Hospital and warned the minister, threatening him to apologize. And so if he doesn't, you're laying down your tools. And indeed you have. Why?
Roland, first, I've heard certain comments by some of your panelists. Unfortunately, some of these are very, very, does not even help their situation and seem to even inflame things the more. Partly because probably these people are not even on the ground. They have not been present at the emergency where doctors have been beaten, slapped in recent times just because there's no bed to receive a patient and it's not those staff's job to provide those beds. That place has been known to be a place where sometimes workers are actually taken on assaulted without much remedy. And so when you go out there and a public spectacle is created and certain prejudicial comments like negligence are made, please, as the lady was speaking certain things about negligence, negligence is not a word you just use without a cause. It is a strict term that has criteria that must be fulfilled. So sometimes we use it loosely and think it's for nothing. Please, many people allege negligence and it goes to court and actually it's not proven. And so let's be very careful how we use that, because we create a situation where we create distrust in the health system and then turn around and blame the same system for problems. So the minister went there. We have no problems with the minister going in with to do spot checks and all that, which is, it's not bad to see how situations are. But in the subsequent engagements, which could have been handled in a better way, there are boardrooms there that the discussions could be had. Nobody is saying that doctors are above reproach, cannot be reprimanded, cannot be even punished or sanctioned. We are just saying the manner in which it has been done. And especially the lady talking does not know the facts. The person was brought in a certain state, and they did their best. What was the problem was that there was no available ventilator to put this person on. The person was being encouraged to that. What do you do in the meantime? My sister, if you need a ventilator, it means you need a ventilator and a machine to breathe for you at that point and help support your heart. You can't do that continuously with the manual bagging that they even have to do for several minutes before they were even trying in attempting to find a ventilator to put this patient on. So let's be very cautious how we handle the issues. And we think that the doctor was maligned, how he was spoken to, treated in this instance. And this is one of the few neurologists, in fact, the only, if you took Confrontation out there in the upper aspect of the country, overworked, put in his resources, and if you had one nurse there telling you, this is somebody who uses his money to fuel water tankers to bring water, buy water to support that emergency. Nobody is saying because of that, don't critique him. But the way and manner and the fact that he wouldn't even be listened to explain when he's being asked the question and shouted on by the MP, even not to be listened to, is not the best.
All right.
Again, there's a misconception being created that he said the death of the person was being blown out of proportion. Please, let's not distort facts. The man was saying that he had taken his time to explain to the families and the relatives, counseled them at every stage of their way, and so did not even anticipate that this issue was going to go out there and actually be blown to the extent that it was. Because, and the extent, if you go on that social media post that initiated all of this, threats are being issued on his life. People are saying they are going to beat people because they are not helping them. They should provide the machine. To the extent that somebody is saying that what did the doctors do with their salaries? Can they buy that ventilator? So you realize that it's created a brouhaha. Today I was listening to FM stations in Tamale. People are threatening all sorts of things. These are real threats. So please, when you sit in the studio and make certain comments, you should put yourself in the shoes of people there working under trying conditions and having to be now subjected to some of these things. So
Dr. Salome.
Yes.
So it is the position of the doctors or the GMA chapter at the Tamale Teaching Hospital and then at the national level, where you are the General Secretary, that the Minister for Health, the MP for the area, who also doubles as a Deputy Roads Minister, perhaps if they had a better understanding of the situation and then appreciation of the situation your colleagues work in, wouldn't have perhaps been quite reactive as they are. Is that the position?
Of course, they should. You see, it's not even about perhaps or if they understood it or not. What we are saying is the method and approach used could be more decorous and could be held in a proper place. Moreover, best practice and ethics demands that you don't do patient inquest in public. And that is why even in the most advanced countries, you don't hear patient inquest in public because it has a tendency to flare up emotions and create perceptions that may actually lead to very dangerous outcomes for both the professionals and the healthcare system. It has medical-legal consequences for the facility. People may get up and sue facilities for various reasons, which may not even be so. You may end up winning the case, you may end up losing the case, but even the time spent by the professionals in the court, the hospital and all that, which are bedeviled with already low finances, may create problems for you. Beyond that too is the risk that we are posing to the staff who are there and the patients themselves, who some of them may lose trust in the health system, seek certain alternative care, and then come back with bad outcomes.
Dr. Salome, this one you are polishing, you are using English to polish the thing. We all watched the video.
Yes.
And the way the medical practitioners, your colleagues, spoke within the seeming situation that the health minister and his colleague assess that situation or the scenario doesn't reflect what you say. And then also, why should he be apologizing when there is video, even though there's a backstory to explain the situation that we saw in the video? Why should he be apologizing? Many don't get it. I don't get it.
Roland.
Doctor.
Roland, please.
Doctor.
You've only watched how many minutes video of a long out a tour of a minister going from here to there and all that. What do you claim you saw? Are you aware of the patient's details and what has actually happened? You only had pieces of it. So you are not even apprised to even be saying you don't understand. You are not even apprised of the condition in which the patient came, what efforts were made, what was even the prognosis in the first place, chances of survival and all that, and what efforts were put in. So that is why we are not supposed to be prejudging this matter. It is improper and unprofessional for me to even be giving you certain details in public, and that is why I will not be tempted to do so. Else you would have known that the situation could have been handled better. Beyond that, I am asking,
Dr. Salome,
that discussion not have happened in the boardroom?
Please let me talk.
After meeting them, could that discussion not have happened outside the camera?
Dr. Salome,
for discussions to happen, and subsequently you come out and Dr. certain key findings.
Dr. Salome, I understand the standard operating procedure that you're outlining. I'm talking about a situation, there's a bust up on live video. There are journalists who have captured this, there are bloggers who have captured this, and this is on live video. And I'm saying the reaction of your medical people, irrespective of what might have pertained 48 hours earlier in the run-up to somebody dying or a patient dying, or perhaps how they helped in the treatment, etc., that resulted in the fatality. We're talking about the situation as was reported, we have witnessed as well. And I'm saying that the reaction of your medical people leading to the bust up and the reaction from the health minister certainly is not right.
Roland,
I'm not talking about your standard operating procedure.
Reaction of the head of department. What did he do? He was asked a question, he was explaining. What was his reaction? I don't even know what reaction you are talking about. What did you see in the video? What reaction did he do? You tell me. He did not reaction. He was asked a question to explain. Then he was asked whether if he doesn't have the things he needs, what could he do in the meantime? Then he's trying to explain what he had done. Then he was told about communication. He then goes ahead to explain that at every stage he's counseled the person, talking calmly and respectfully to the minister and then the MP and the entourage. What exactly did he do wrong? You tell me. Did he shout? Did he disrespect them? He's asked a question, he's responding. Actually, the proper thing would have been for him to decline comment on that particular case because it is actually not ethically right. But I'm sure it will also be interpreted that he doesn't respect, that is why he's done so. And so he found the need to find a middle ground and explain certain details about the case. And so in doing so, what exactly? Because you are saying that they didn't do right, the medical people. It's one person we are talking about here. And what did he do wrong? You have not shown anything that the doctor did wrong in that particular video. What is being purported to be said that he claimed that the death of the person has been blown out of proportion, he didn't say so either. He was referring to things that had emanated with a post written by somebody who was not even particularly there on the ground at the time. When the incident happened, to even know what explanations had been given the family, what had been done. In fact, in that post, you will note that the person even commended the doctors and the staff at the emergency. And so maybe you need to apprise yourself of some of these issues because you haven't said anything the doctor did wrong. So if he didn't do anything wrong, why was he being shouted on? And even if he did anything wrong, is that the appropriate forum? Those sitting on the set, would they appreciate that they be shouted on and not even allowed to explain, especially in your field of expertise, when you need to clarify the issues probably to bring understanding to the issue?
Dr. Salome, the position of the Ghana Medical Association and then your colleagues at the TTH is that either he apologizes or the strike continues.
Well, our colleagues have met. They are the ones on the ground. They are the ones undergoing the threats as we speak, even still on radio. And they are the ones. And I'm saying that let's not take certain things lightly. People have been beaten. One of the executives there was slapped and beaten to pulp issues reported to the police. To date, nothing has happened. A nurse was beaten, all because there was no bed.
Okay.
Okay, which is not their fault to provide, but they were beaten. Some of you reported a security man being beaten and killed at Kolebu Accident and Emergency Center some time back because they were trying their best to help. Most of these people who are sitting there have not been through these threats, and these people also have families. So it is only nice if the minister or the MP, what does it take to hold this young man and just come to the media and say, look, we've made peace, let's go back to work. In fact, this is the roadmap to address some of the concerns. In fact, I'll be working with you to address the concerns. Who is even the beneficiary? These machines that are being asked for, is it the doctors who carry them home? It's the people who actually benefit. And that is what I'm saying. People who are complaining are not innocent bystanders. They are willing accomplices. How have they asked the MPs in that area, in and out of government, for all these years that the hospital has had water problem, to solve that water problem? How has the lady in the studio saying some of the things?
Please, we have two ladies. Dr. Salome, I take Dr. Salome. I take exception to the way you have attacked my ladies in the studio. You are reacting to their comments. That's fine, but
yes,
you don't.
I am listening to the comments.
No, Dr. Salome. Dr. Salome, with all due respect, we give you, Dr. Salome, we give you the due respect, and so I also expect that. I also expect that you accord the panelists also the due respect. Opinions
I am saying that
yes, but you don't say that that lady in the studio. I think it's quite offensive.
Which lady?
Because we have Dr. Susan Edouard-Mankwa. He's also a distinguished professional in his own right, in her own right. And so let's please. And then we also have Awo also here, because also a distinguished professional in her own right. So let's all accord each other the respect, okay?
I totally acknowledge that.
So I asked the question. You haven't answered me. And the specific question again, I'll remind you is that it is an apology or you won't go back to work. I'm not specifically saying your colleagues, but you haven't answered me.
I believe that is the first step in all of this. It helps to calm tempers and also signal to the public that certain things are being done.
So the minister should apologize, or you will not go to work.
We, our colleagues, we stand by them. That is what they are saying. And we believe that the minister will listen, and we believe that it is not beyond the MP and the minister to do so.
Dr. Richard Salome is the General Secretary of the Ghana Medical Association. On a private level, he's also my friend, my very good friend. Very, very good friend as well. Let me say that. But he's a professional, so he's doing his work.
In the first place, I don't recollect us here ever talking about negligence. Negligence is a legal term. To prove negligence, there must be certain conditions. I don't believe that I have said anything to do with negligence here. Okay. So that has to be corrected. And then we're talking about ethics. Look, maybe with the health professional, he knowing that it's unethical to be talking about the patients or whatever in public, should have found a way to move the minister and the same. I mean, of course, wasn't the director of the hospital there? You know, the director of the hospital was there. You could have, moved it away and say, oh, can we have this discussion at the boardroom level, and we can explain to it, considering data privacy of patients, etc., and etc., and etc., things like that. I don't think that, I mean, if such words had been uttered, you understand, it would not have the same. So, I mean, really, look.
But they hold their position, an apology or no apology.
He talks about people being beaten and slapped and everything. Is that what they're asking the minister to be apologizing for? That people are beaten and people are slapped? Look, I think that we shouldn't mix up the issues. Something has happened. We all know the frustrating work environment in which our health professionals work. It is. It's frustrating. And it doesn't, tempers are afraid and things happen. This has happened, okay? It's a different issue into dealing with what you call it, people being beaten, people being slapped, etc., etc., etc. I think that we need to divorce them. You get it? You asked me a question. Are they asking him to apologize because he spoke harshly to a doctor? Is that why they would put other people's lives on the line? You understand? That's the plain and simple bottom line. You understand? So, I mean, they should, they can take their stand. And their stand is, they didn't like the way they were spoken to. So they would use to put human hostages to get their way. I say, the minister being who he is, he should just apologize so that lives are saved. And then the other issues about they being beaten and things, he's not apologizing for they being beaten because he is not initiating that. But then we can look at the whole health infrastructure so that those things can be mitigated. What kind of risk assessments have they done in that hospital there? You understand? And what kind of mitigating procedures have they put into place to ensure that the people get the best service and they themselves, as the health personnel, are protected? So I think that we should look at the bigger picture.
I know you wanted to speak, but the time is up, unfortunately. The time is up. So, and thank you, everybody else. So I have this one from Bernice, who says that, according to Tony Goodman, the doctor questioned why the fast over just one death. And we're told the minister responded by saying one death is enough to warrant this coming. So there seemed to be a misconception. So I have a lot of messages coming in, Abiti and everybody else. Nane Asapo also sent a long one as well. And all of you who money says that all the doctors should resign. BT Sla as well. We're taking a break. We'll be right back.